The subject we'd like to discuss is the Berwick nomination to be administrator of CMS. To be perfectly frank with you, I think many of us are alarmed by this nominee's focus on the British system, where government makes decisions for people on their care. In fact, I'm reminded of a decision by the Department of Health and Human Services that I personally had a good deal of concern about last summer, to limit the dissemination of information by companies who were in the Medicare Advantage business so that they could not communicate with their customers, clients, their opinions about legislation that would affect their product. A stunning government gag order, in effect saying to a corporation, you're not free to discuss a public issue before the Senate and the House. We're going to tell you what you can say. I mean, one of the most blatant examples of the government basically squashing free speech is a condition for doing business with the government. Now we have this nominee who is applauding a system where care is delayed, denied, or rationed. So I'm particularly concerned that this attack on free speech is just a first step toward much greater government intervention. I'll be talking with Dr. Berwick about his plans, but now I'd like to turn to Senator Roberts, who I know has already spoken with Dr. Berwick, maybe even as recently as today, and get his thoughts on this nominee for this very important position.
If the distinguished Republican leader would yield, I'd be happy to respond. I would tell the distinguished leader that, and first I want to thank you and the doctor from Wyoming, who is always bringing new and important information about the health care bill and some of the problems that we are experiencing. But thank you for allowing me to join in this colloquy. We're talking about President Obama's nominee for the administrator of the Centers for Medicare and Medicaid Services, and we call that CMS. That's the acronym. Rest assured, every health care provider in America knows about CMS. And the nominee is Dr. Donald Berwick. And I just met with Dr. Berwick and had an opportunity to hear some of his thoughts on the direction he thinks American health care, and particularly Medicare and Medicaid, should take. He is a very affable, friendly doctor from Connecticut. He has a wide background in terms of health care. And I've also been reading up on Dr. Berwick, who has a prolific record of statements and speeches and books that further lay out his ideas for the future of health care. I recommend everyone within the healthcare industry and every healthcare consumer to get a hold of these speeches and these statements and, if possible, books and read them. And here's what I've learned. Dr. Berwick, I would tell the distinguished Republican leader, is a huge fan, a major champion, and a contributor to the British national healthcare system called NHS. As a matter of fact, I have a quote: "I am romantic about the National Health Service. I love it. The National Health Service, or NHS, is not just a national treasure, it is a global treasure." Well, I understand that people can become very passionate about their jobs, but romantic seems to me a little bit unique, but we'll let that go. Why is this important? Because the NHS rations health care, and the NHS denies and delays patient access to therapy in regards to breast cancer, Alzheimer's, multiple sclerosis, kidney cancer, macular degeneration. This happens to be my favorite example. Patients require to go blind in one eye first before they get treatment for the other eye. Brain tumors, patient group coalition called the group that rations healthcare in Great Britain unfair and unacceptable. The quote by Dr. Berwick is, "The decision is not whether or not we will ration care. The decision is whether we will ration with our eyes open." So consequently, And I think that the good senator from Wyoming has something to say about that in regards to rationing health care and the British system.
Well, Mr. President, I agree absolutely with my colleague, because that is exactly what is happening in the British healthcare system. It is delayed care, and delayed care to me equals denied care. And this has been such a major topic for discussion among the people in Britain that it was brought up in the recent debate for the prime ministership in the election, the first televised debate ever. And one of the questions was asked of then Prime Minister Gordon Brown. And they said, what about the National Health Service? People have to wait too long. And here's the quote. We have a transcript, because I read about this in the local papers, got the transcript, and he talked about people with cancer. Now this is very important to me, Mr. President, because my wife Bobby is a breast cancer survivor. She was diagnosed in her 40s as a result of a screening mammogram. So we spend a lot of time thinking about, talking about cancer, as do many families in this country. Well, this is what he said about people who have cancer. This is Gordon Brown answering the question about what about the National Health Service and the long delayed time before treatment. He said they will also be able to know that their operation, he said, will be in 18 weeks. In 18 weeks, if you're a patient, this is a cancer patient in need of an operation. 18 weeks, Mr. President, for your cancer operation, and that's what the politician, Prime Minister of England, is promising the people as an aspirational goal. It makes you wonder, how long is the delay right now? So it's no surprise when we take a look at the Lancet, the British medical journal, the Lancet Oncology, when their August 2008 summary of statistics says, in every category, Americans survive cancer at higher rates than patients in other developed countries. American cancer patients have a higher survival rate for every major form of cancer than patients in Canada and Britain. American women have a 35% chance of surviving higher percentage chance of surviving colon cancer than British women. American men have an 80% better survival rate for prostate cancer. And I have a list, cancer by cancer: breast cancer, colon cancer, prostate cancer. The survival rates are much better in the United States than they are in Britain. And it is not that our doctors are any better, it is that the treatment is more timely. So can you imagine, Mr. President, being diagnosed with cancer and being told that your operation would be coming in September? I mean, here we are in May, and 18 weeks from now, September is when you'll have your operation. All of that time, the cancer can be growing, the cancer can be spreading. So when you think about that, as a patient in the United States, you say, do I really want Dr. Berwick? Do I want somebody who is in love with the National Health Service of Britain? Someone who says they have incredible respect for the way it works and thinks it's the right way to go? Why would an American citizen want that person to be in charge of Medicare and Medicaid for this country? So I just have to respond to my colleague that, as a physician who has practiced for 25 years and as a husband of a wife who is a breast cancer survivor, who has had detection through a screening mammogram and then very rapid surgery where there actually was a node, a spread from the breast to one of her lymph nodes, I think she is alive today because of the screening mammogram and the timeliness of her surgery and treatment in the United States. So I see the minority leader, and I see he is incredulous that we would be considering that sort of a system and that sort of a director for Medicare and Medicaid in this country.
Yeah, I would say to my friend from Wyoming, Wyoming and Kansas and Kentucky have a lot of rural areas. One of the things that Dr. Berwick has made very clear, there's an article he wrote called Buckling Down to Change, in which he says there ought to be a concentration of services in metropolitan areas. He says most metropolitan areas in the United States should reduce the number of centers engaged in cardiac surgery, high-risk obstetrics, neonatal intensive care, among other services. What he's really saying is narrow the specialties down to metropolitan areas only, And I just think of how that would work in a state like mine. We've got a city, Pikeville, Kentucky, which is in the mountains, about 2.5 hours from the closest major city, Lexington. I wonder how it would work in my state to have to drive 2.5 hours to put their baby in a hospital neonatal intensive unit. I mean, clearly what he's talking about here is major rationing of services, which would be bad enough for the urban areas that are lucky enough to still have the service at all. But for states like Wyoming and Kentucky and Kansas, where we have a lot of people in rural areas pretty far removed from major urban centers, we're talking about a catastrophe, as I see it. You practiced medicine for 25 years. What's your take on that kind of approach?
Well, my take is it wouldn't work for Wyoming. But this entire health care bill, law, travesty isn't going to work for Wyoming, because we hear, and you look at the numbers, and the Congressional Budget Office says that 15% of hospitals in a few years are going to find that they're losing money. They can't stay open. People are going to have to travel long distances to get care, to get quality care. Sometimes with weather, with winter, very difficult. So I have lots of concerns for all of the rural communities in this country because we have somebody from Boston in the big city and doesn't think the way that maybe we do in Wyoming or Kentucky or in Kansas. The other travesty of this is that the President of the United States has been in office now for well over a year, almost a year and a half. And during that entire time, it isn't until just now that he has nominated someone to be in charge of Medicare and Medicaid. And I've continued to ask on this floor, Mr. President, why is that? Why has the President intentionally refused to send a name to the Senate to be in charge of Medicare and Medicaid at a time when this country was debating health care legislation, at a time when the President was proposing cutting $550 billion from our seniors on Medicare, at a time when our President was cramming into Medicaid another 18 million people?
If my friend from Wyoming would yield, some have felt that the reason he didn't want to send Dr. Berwick up during the health care debate was because it would confirm the obvious, which is the direction in which we were headed, and which Senate Republicans said repeatedly during the debate on health care, the direction in which we were headed. Nobody's been more active in this issue than Senator Roberts on the Finance Committee, was massive rationing. But it's hard to believe they had not decided to send up the expert on rationing just as soon as the debate was over.
If the leader would yield, it's one thing to use the British healthcare system and be romantic about it, to quote Dr. Berwick as an example, for rationing, for practicing health care. Cost containment is another thing. Do it by age, which is happening. But rationing by region, which the leader has pointed out and Dr. Barrasso has pointed out, that really should strike fear in the hearts of any person living in any rural area in the country. His tenet for modernizing the American health system is reducing what he calls the oversupply of inventory. That's how he defines it. Dr. Berwick's oversupply of inventory is, in truth, the rural patient's lifeline. I know Dr. Barrasso understands that. As the leader has said, in Kentucky, well, in Kansas, demanding that a patient in Goodland, Kansas drive 200 or 300 miles to Wichita or Kansas City or Denver so that their infant can receive proper care is simply ridiculous. I can foresee a time when the rural health care delivery system will consist of a Band-Aid and a bedpan. Dr. Berwick is the perfect nominee for a president whose aim has always been to save money by rationing health care. And I'd like to add at this particular time, in addition to the rationing that the good doctor and the leader have talked about, the NHS utilizes, that's the National Health System in Great Britain again, an end-of-life pathway to death. An end-of-life pathway to death. That's a shocking description that many British doctors say leads to premature death in patients who could have otherwise recovered. Now, to say that's noteworthy is just unjust. and it's egregious. Dr. Berwick's ideas on end-of-life care seem to mirror this death pathway, and the quote is, "Most people who have serious pain do not need advanced methods. They just need the morphine and the counseling that have been available for centuries." This is a rather stunning statement, it seems to me, but it is very similar to President Obama's remarks about the elderly approaching the end of their life. The president has said that as you get older, maybe you'd be better off not having the surgery, but just taking the shots and the painkillers. The only thing missing in that is the walker. And so consequently, he has also remarked that the chronically ill and those toward the ends of their lives are accounting for 80% of the total health care bill out here. We know that. There's going to have to be a very difficult democratic conversation that takes place, end of quote, by the president. Well, it sounds like this difficult democratic conversation has already happened in the United Kingdom, and that the pathway to death solution mirrors Dr. Berwick and President Obama's ideas exactly. But age rationing, as has been indicated, is not the only way to do it. As the leader has pointed out, we have regional discrimination as well.
Well, it is interesting looking at this whole thing, because what we see happening in Britain right now, and there is they call it NICE, but there is nothing nice about it. It's their National Institute for Health and Clinical Excellence, and what Dr. Berwick has had to say about it is very much the opposite of what doctors who practice there have said. And what he has said about this system is that those organizations are functioning very well and are well respected by clinicians, and they are making their populations healthier and better off. But a London colon cancer specialist says, a lot of my colleagues also face pressure from managers in the British health system to not tell patients about new drugs. There is nothing in writing, he says, but telling patients opens a Pandora's box for a health service trying to contain costs. So it gets down to not quality of care, not availability of care, but the cost of care. Dr. Berwick says NICE is extremely effective and a conscientious, valuable, and importantly knowledge-building system. Well, this is what someone says. Doctors are keeping cancer patients in the dark. This is a quarter of specialists polled by Melanoma United Kingdom. Doctors are keeping cancer patients in the dark about expensive new drugs that could extend their lives. So let's keep people in the dark rather than tell them what is there that can help extend or save their life. That, to me, is not a system that the American people want. So we...
Could I just ask a friend from Wyoming who practiced medicine for 25 years, the Congressional Budget Office just said yesterday that this bill is going to cost $115 billion more than was portrayed here on the Senate floor. Would it not be reasonable to assume, based on this nominee's views on the issue of rationing, that it could be that the way they intend to save that $115 billion, if they do, is with massive and extensive rationing, by nominating an individual who's expressed himself so clearly and unambiguously on the virtues of rationing, and the exploding cost that everyone, the administration's own actuary, the Congressional Budget Office, everybody who knows anything about this subject is weighing in the aftermath of the health care debate and confirming the concerns that Senate Republicans raised during the debate. Every single one of them has been confirmed by independent groups that this is the way they intend to cut costs.
I would say to the leader that this really isn't anything new. Dr. Barrasso has been predicting this for some time, those of us on the Finance Committee and the Health Committee. We got a double dose, and during the health care debate, we tried to warn of the 4 rationers that were embedded in the bill. That's what I call them. Made several statements on the floor. We have the Patient-Centered Outcome Research Institute, the Independent Medicare Advisory Board, the CMS Innovation Center, and the U.S. Preventive Services Task Force. Dr. Berwick was actually the vice chair of the U.S. Preventative Services Task Force until 1996, And you remember this, you may remember this, as Dr. Barrasso has already pointed out. This was the body that recently ignited a firestorm by recommending that women wait until age 50 before they receive a mammogram. That recommendation certainly angered many women and their doctors in America, and whoever said that beat a hasty retreat. We also warned that Obamacare, Mr. Leader, and my friend from Wyoming, will result in higher costs, not lower, a prediction not only by the CBO, by the bravest man in America, CMS actuary Richard Foster, who is amazing to me that he's still on the job, thank goodness, recently backed all of that up in terms of higher premiums, higher costs, rationing, access to doctors by the elderly, and has renewed his warning time and time again. So now our predictions are coming true, and President Obama's CMS nominee, Dr. Berwick, will be the man who cuts healthcare costs by putting the rationing plans into practice. They will call it cost containment, but it will be rationing. So I hope that my colleagues will join me in carefully reviewing the statements and the speeches and the books and everything else that good Dr. the good Dr. Berwick has stated in the last 30 years on rationing. I think that if we do that, that most of us will agree that he is the wrong man, wrong time, wrong job. And I thank the leader and the good doctor for allowing me to join in this colloquy.